Hi everyone, I'm Dr. Ryan Bailey, a pelvic floor physical therapist and founder of Expecting Pelvic Health. If you are pregnant and thinking about your upcoming birth, you've probably heard about perineal tears, or maybe you're a little nervous about them. Today, we're going to be talking about two key things you can do to reduce your risk of severe tearing during childbirth. One is knowing your perineal length, and two is using perineal massage. First, let's talk about perineal length. The perineum is the tissue between the vaginal opening and the anus. This is the area that stretches a lot during delivery. And research shows that the length of your perineum can actually predict your risk of severe tearing, also known as obstetric anal sphincter injuries, or OAC, during childbirth. Women with a shorter perineum, which is less than 3 centimeters, are at higher risk of third and fourth degree tears. But here's the thing, most women don't know their perineal length, and often this isn't something that's routinely measured during prenatal visits. So this is where you can advocate for yourself. I encourage you to ask your provider to measure your perineal length, and this can give you valuable information that helps guide your birth plan and delivery options. If you know you have a shorter perineum, you and your provider can discuss strategies to reduce your risk of tearing, like perineal massage and delivery techniques. This kind of proactive step can make a huge difference in your birth experience. Now let's talk about perineal massage. The purpose behind perineal massage is to help the perineum and the surrounding tissue stretch more effectively during childbirth. But it's not just about stretching the tissues. We're also training the nervous system. When the perineum stretches during labor, it can trigger a fight or flight response in the body. And perineal massage helps prepare your body to reduce that automatic tensioning, making it easier for the tissues to stretch without tearing. Research shows that perineal massage is best started no later than 35 weeks of pregnancy. But here's why I encourage you to start thinking about it much earlier. First, you might go into labor before 40 weeks. You may not know that 37 weeks is considered full term, but we know labor can happen earlier than 40 weeks. So starting perineal massage before 35 weeks gives you time to learn the technique and get comfortable with it. Second, you want to check in with your pelvic floor first. During pregnancy, your pelvic floor is lengthened and working really hard, which can increase tenderness and tension without typical pelvic floor symptoms that may lead you to get assessed. It's important to address these before starting perineal massage, which will take time. Your pelvic floor physical therapist can help you work through these issues so you're starting in a healthy place. Third, perineal massage can be hard. Not only may it be hard to devote the private time to performing it, but it can be challenging to work around your belly, even with new devices on the market to help. And four, as you get closer to your due date, the focus naturally shifts toward preparing for your little one's arrival. By starting a perineal massage routine earlier, you've already established the habit before that final stretch when your attention is more on baby than on you. Now let's talk about the basic steps to perineal massage, remembering that if you have any pelvic floor tenderness, you may need to do things prior to this. First, wash your hands and make sure your nails are trimmed to avoid discomfort. 2, get comfortable. You can sit or recline with pillows as long as you can get around your belly and reach the perineum. It's also a great thing to do after a warm bath or shower, which helps you relax more. 3, use a water-based lubricant or oil like vitamin E oil or coconut oil on your fingers to reduce friction. 4, insert your thumbs or fingers about 1 to 2 centimeters into the vaginal opening. 5, press down towards the anus and out towards the sides of the vagina, creating a U-shaped motion. You're aiming for a really gentle stretch that doesn't cause a lot of pain and holding that stretch for about 1 to 2 minutes, which is about the length of a contraction. Use your breathing with this to help you relax the muscles and avoid tensing up during the massage. As you're inhaling, think about creating more space and length. And then when you're exhaling, think about the exhale releasing any tension. Perineal massage should never be painful, but you might feel a bit of a burning sensation or some discomfort as the tissues stretch. This is normal, but should never be more than a 3 out of 10 pain. Aim to do this several times a week for about 5 to 10 minutes each time. Starting before 35 weeks will give you plenty of time to practice and allow your perineum to adapt gradually. Remember, it's never too early to start advocating for your perineal and pelvic floor health. Know your perineal length, ask for support when you need it, and take the time to prepare your body for the incredible work it's about to do during childbirth. If you found this information helpful, don't forget to like and subscribe and check out my free guide on the preparing your pelvic floor for birth with the link below. Your perineum will thank you.